China hits back at countries blaming it for global COVID-19 outbreak. Trump angers Beijing with China virus tweet. China's need for official secrecy and the Trump administration's need for a coronavirus scapegoat are combining to lend credibility to conspiracy theories. Could science become a victim of the political of the pandemic? President Donald Trump has caused controversy by using the term Chinese virus or China virus to describe the coronavirus. China's early response to coronavirus have been widely criticized across the world. Authorities in Hubei province initially tried to cover up the outbreak in Wuhan and allowed millions of people to continue to travel. The delayed containment and mitigation measures potentially spread the pathogen further. To its credit, China managed to contain COVID-19 in few weeks by putting in place draconian restrictions in people's movement and systematic quarantine regimes in cities like Wuhan. But the Chinese government's demonstrated lack of transparency also drives a global narrative that Beijing is hiding something. This can provide fertile ground for conspiracy theories, which complicate rational analysis of where the disease came from and how it can be stopped. However, despite Chinese initial cover-up, the world was aware that COVID-19 was a severe threat before the full brunt of the disease reached the US. The differing response by the Trump administration included weeks of denial and mixing messages. When it was clear in March that COVID-19 was spreading rapidly around the country, disjointed federal action left states to fend for themselves. The US is now the world leader in the total number of cases and deaths, although it fares better than European countries like Italy, Spain, and the UK when it comes to case fatality rates. For latest current affair news, subscribe News 786, like and share. The political opportunity for the Republicans is that blaming the virus in China gives them a chance to deflect blame for Trump's poor response to the crisis. As the pandemic gets wrapped up in politics, there is concern that investigation into the origin of SARS-CoV-19 will be skewed away from science, as the US pours resources into probing the Wuhan lab or for a smoking gun that would cement claims of Chinese culpability. The WHO's emergencies chief, Michael Ryan, recently warned against politicizing the scientific investigation into origin of SARS-CoV-19. We can learn from Chinese scientists, we can learn from each other, we can exchange knowledge and we can find the answers together, said Ryan, adding the scientists should be at the center of exploring where the virus came from. And as political tension increases, international scientific cooperation on understanding how viruses like SARS-CoV-19 originate and proliferate also comes under pressure. For example, in late April, the US National Institute of Health cut funding for a project studying how coronaviruses transfer from rats to human because the project sponsor allegedly used funding to cooperate with scientists at the Wuhan Institute of Virology. In January, China also temporarily closed a lab in Shanghai that first discovered the genome sequence of SARS-CoV-19 after one of its scientists shared this information with colleagues around the world online. Beijing claimed the lab was closed for rectification. President Donald Trump has caused controversy by using the term Chinese virus or China virus to describe the coronavirus. Half of the California voters hold China largely responsible for the COVID-19 pandemic and shortages of medical supplies and tests. But voters broadly reject the use of the racial labels of the virus, according to the report from the UC Berkeley Institute for Governmental Studies. The report released today found that just about 50% of the voters believe the Chinese government is mostly or completely responsible for the pandemic and for shortages of key medical supplies, with another 29% saying China is somewhat responsible. But the voters reject the terms such as Chinese virus or Wuhan virus, which have been used by President Donald Trump and some other government leaders as labels for the pandemic. Among all voters, only 29% say it is appropriate for Trump to use such a term, versus 60% who say it is not. But nearly 61% of the Trump supporters strongly agree that it is appropriate, compared to just 3.5% among his opponent. The findings suggest that the use of the racialized language by the president and others is being adopted by his supporters and possibly diverting attention from the administration's management of the pandemic, said reporter author Aline Y. Heron, a research fellow with Berkeley, California Initiative for Health Equity and Action. The pandemic emerged in Wuhan in China in late 2019 and has since spread to every country in the world. More than 4.5 million people have been infected. Confirmed deaths in just May 14 were 300,000, with more than 80,000 of them in the United States. Nothing that Asians have historically been blamed for being disease carriers, the IGS report said the pandemic has provoked a wave of anti-Asian sentiment, including over 115 racist incidents nationwide between mid-March and mid-April. Critics have charged government leaders with using racial labels for the disease to shift blame from the White House response to the pandemic, but in the process encouraging hostility directed at Asians and Asian Americans. As COVID-19 continues to cut a grim path across the globe, debates continue to rage about who is to blame. In one of his many moves to shift accountability for his own inept response to the crisis, US Donald Trump said he would place a hold on funding for the World Health Organization, alleging the agency willingly took China's assurance to face value and pushed China's misinformation. But the truth is that everyone, the US government, the WHO, journalists, public health officials and others should have known better than to trust Beijing's claim, whether it is initial dismissal of the possibility of human-to-human transmission or in its current report of the infection and death toll numbers. In China's one-party authorization system, officials suppressing information or manipulating data for propaganda or career advancement is nothing new and likely won't change anytime soon.